So attachments are given for two purposes. One, for the fit of the aligner, for the aligner to seat properly onto the teeth, and the next one is it acts as a purchase point. Similar to, if you see here, the door has a handle. So where will be the handle kept? Will it be near to the hinge or away from the hinge? Closer to the hinge or away from the hinge? Away from the hinge, so that we can get a good purchase point and the mechanical advantage is more. So similar to that, these attachments that will increase the surface area of contact between the tooth and the aligner, and also we'll be able to direct the forces according to how we plan. So we'll have a better control over the tooth movement. So nowadays, everyone are social media influencers, celebrities and all. So sometimes patients would be hesitant to bond an attachment itself. So such patients, you need to make them understand the importance of attachments. So in the near future, definitely we can do away with the attachments because a lot of research is happening where attachments can be incorporated inside the aligners itself. But as of now, even in Invisalign, they do with attachments only. Okay. So what are attachments? We will discuss. So attachments are nothing but composite buttons, composite blocks that are bonded onto the tooth. So these are the steps you have to follow while bonding an attachment. It's very easy because as experienced practitioners, you would be doing composite restorations or you would be bonding the brackets. So similar to how you do that, you have to bond the attachment. So you will get an attachment template. So this is what an attachment template will look like, and there will be depressions in the area where you have to fill the composite. And the next question what usually comes is, what is the best composite to use? Should we use flowable? Should we use packable? So I've used all the types of composite in my various patients. So one thing what I've noticed is, it's always better to use a packable composite or a bulk fill composite, because flowable composite, the bond strength that we get is lesser. So what I have personally seen is the chances of bond failure is more, especially in the posteriors and all. So, and if you take packable, it's very hard. So if you take bulk fill, means the viscosity is ideal, and at the same time you will get a good bond strength also. But it's again up to you. I'm just telling my personal opinion regarding that. Yeah, flash will be there, yes. And if flash is excess, that will affect the fit of the aligners, yes. So you can take, optimal quantity of this one, packable composite, and if you want to, make it a bit more viscous, you can add a little bit of bonding agent onto it, then nicely adapt it onto the depression, and then you can keep it. Then another thing what you have to keep in mind while bonding the attachments is, you need to make sure that the attachment tray fits properly when you keep. Because why I'm telling it is because sometimes I see cases where doctors have bonded the attachments, but the attachments are not bonded exactly at the point where we want, especially in the posteriors and all, because that will be overhanging, and doctors in hurry they might not notice. So if you want, you can just give a little bit of finger pressure occlusally so that the attachment tray will seat properly. And the attachment tray material what we use is a flexible material, not like the normal aligner material, so that it's easy to remove and all. So just when you bond the attachment, make sure you give a little bit of finger pressure and make sure you bond it exactly at the same point. Otherwise, definitely inadvertent movement will happen. Just imagine an attachment is bonded incisely than how you planned. Then when the patient wears the aligner, the forces are going to get transmitted incisely. So incisely, if you transmit the force, means the tooth is going to intrude. So these small points you can keep in mind, definitely that will improve the quality of your aligner practice. So now coming on to the types of attachment, there are various shapes of attachments. Now AI is coming into play here. So last month only a team from our side had gone to IDS Germany, and now completely AI driven software is coming. Within 5 minutes you will get a design case. There's no need for any technicians also. But we have not totally switched into AI because definitely we need to take care of some intricacies and all. But what I'm telling is, the world is moving at such a fast pace. So when it comes to the shape of the attachments, we will just discuss about the conventional attachments. So nowadays, something known as optimized attachments are there. That is, derived from the conventional attachments. And for each case, different shapes of attachments are coming. So we will not discuss about the optimized attachments. We will just discuss about conventional attachments. So this is a recent systematic review I was just going through. So this also, helps us to understand the various shapes of the attachments, various effectiveness of the attachments also. So this is one of the shape of attachment, ellipsoid attachment. So this will be elliptical in shape. So whenever you see an ellipsoid attachment, you can understand that is given only for the retention of the tray. This doesn't play much of a role in the movement. This is just given for the retention or the fit of the tray. Now coming on to the vertical and rectangular horizontal attachments. So I would say this is like a universal attachment, because whole lot of biomechanics we can control using these attachments, because this is like a broad, very thick attachment, so that will improve the surface area of contact, like I was mentioning before, and that will definitely help us to do a variety of movements. For example, in all four extraction case, we need to prevent the dumping of canine and the second premolars onto the extraction site, the roller coaster effect and all, like we call. So to prevent that, we can give these horizontal, the vertical rectangular attachments, and we can build, inbuilt tip we can give, so that will prevent the dumping. And then the horizontal rectangular attachments we can give in cases where we want to torque, and also in case of augmentation of anchorage, we can bond the horizontal rectangular attachments onto the sevens also. That will help us in augmenting the anchorage. So these rectangular attachments play a very important role in the planning of treatment. Then the next one is beveled attachments. So beveled attachments are used for extrusion and intrusion. So if you see here the bevel is towards the cervical area, that is used for extrusion, and the other side, so if it is in the opposite direction, that is used for intrusion. Then pyramidal attachments are used for, these are not commonly used, this is because this has a line angle, and the chances of debonding is more. Since I saw in the literature, I have just put it, but this is used only for the retention of the tray. Then the quarter sphere attachments are there. So like the name suggests, these are like a quarter sphere. So this can come as a solo attachment and also as a couple attachment. So in midline diastema closure and all, if we bond an attachment closer to the cervical area, that will help in the movement of the root also along with the crown. And then, it can be used as a single attachments in case of canine rotation, premolar rotations and all. Then molar uprighting attachments are there. This is nothing but horizontal rectangular attachments only. It's bonded at an angle of 45 degree. And definitely molar uprighting and all, it will take a lot of time. You need to follow it up, give many multiple layers, and also give multiple aligners for it to settle down.